experienced a shoulder dislocation. You can see some people have habitual shoulder dislocation, whereby they themselves relocate the shoulder once it gets dislocated. And shoulder dislocation is one of the most common problems suffered by athletes and also among common people. In order to understand how a shoulder dislocation can cause recurrence, first of all, let us look at the anatomy of shoulder. You can see that this is the anterior view of the shoulder and this is the posterior view of the shoulder. If you look at the shoulder joint, you can see that there are several muscles surrounding the shoulder joint. And there are two tuberosities on the shoulder joint called the greater tuberosity and the lesser tuberosity. So, the muscles, also called as the rotator cuff muscles that attach onto these tuberosities are: one is the supraspinatus muscle, which arises from superior to the spine. That's why it gets the term supraspinatus and attaches onto the greater tuberosity. The next one is the infraspinatus, which arises just inferior to the spine of the scapula and attaches to the greater tuberosity itself. Then the next one is the teres minor, which is formed from the border of the scapula and attaches onto the greater tuberosity. And anteriorly, you can see that there is a muscle arising from the anterior aspect of scapula and attaching onto the lesser tuberosity of the humerus, and this is called subscapularis. So this is supraspinatus, this is infraspinatus, this is teres minor, and this is subscapularis. So if you look at this image, you can see that the inferior part of shoulder is rather deficient. Furthermore, shoulder joint is also surrounded by a capsule and there are certain ligaments around this capsule. So if you look at the anterior view, you can see that there is a ligament arising from the glenoid to the humerus, and that is called the glenohumeral ligament, which is divided into three. One is the superior glenohumeral ligament, then comes the middle glenohumeral ligament, and then comes the inferior glenohumeral ligament. But the inferior glenohumeral ligament is like a hammock, and it is usually looser than the superior and middle glenohumeral ligaments. So the shoulder has a propensity to translate inferiorly because the inferior portion of the shoulder is weaker. But most of the trauma occurs by a posterior to anterior directed force on the shoulder. So the most common dislocation of the shoulder is towards the anterior with slight inferior translation. So this is how a shoulder joint dislocates anteriorly. And one of the lesions that causes recurrent shoulder dislocation is called the Bankard's lesion, which is the antero-inferior labral tear. How does this lesion occur specifically at that position? That we will delve into detail. So suppose this is the shoulder joint, this is the head of the humerus, this is the glenoid, and this is the labrum. So when the shoulder joint dislocates anteriorly, you can see that it tears off a part of the anterior portion of the glenoid labrum. Furthermore, you can see that if you take a coronal section, you can see that the shoulder has a propensity to dislocate inferiorly as well as anteriorly. So in a three-dimensional plane, you can see that the Bankard's lesion is in an antero-inferior fashion. Another thing to note is that once the shoulder gets dislocated, the head of the humerus starts hitting on the glenoid rim, and as it starts hitting on the glenoid rim, a defect will be formed at that portion, and that is called a Hill-Sachs lesion. So these two lesions are responsible for recurrence of shoulder dislocation, which is the most common complication of any shoulder dislocation. So this is an X-ray which shows both the Hill-Sachs as well as the Bankard's. So Bankard's can either be a simple labral tear or it can also cause the avulsion of the bony part of the scapula. If it is visible in the X-ray, then it is called a bony Bankart. Here you can see that there is an avulsion of the anteroinferior glenoid cavity or the glenoid rib along with the labrum. And here you can see that there is a defect in the head which is formed during shoulder dislocation, and this is called the Hill-Sachs lesion. So these are the two culprits that cause recurrent dislocation of the shoulder and needs to be addressed if the patient wants relief from recurrent dislocation.